We have some people running late. There was an accident and I hear that traffic is bad in Lexington. So, which always depends on which way Google Maps is going to take you or Waze. So that's always makes it really interesting, the traffic, especially with school in session, with campus and all of that good stuff. So thank you all for joining us today at our annual conference. Today, we're talking about innovating for better health outcomes. So we're really excited to have everyone here. My name is Brent McCune. For those that haven't met me, I'm the Managing Director at the Kentucky Regional Extension Center, and I'm excited to have you all here in attendance. We also have a virtual option today. And so we do have a lot of people that are online. That's for those people that are remote in Western Kentucky and Eastern Kentucky as well that couldn't make the trip today. So we'll start with doing some little cleanup things here. First, our Wi-Fi is, if you need to connect to Wi-Fi, it is open and free. It's called Campbell House Conference. So please feel free to use that. I mentioned that we have a virtual presence, so we are utilizing the HUVA app. So if you log in or if you've received emails from HUVA, we have our exhibitors there. We have all our speakers there. We will have presentations available there. You also have the option throughout the sessions to ask questions through the HUVA app. So if you don't want to ask any questions after the presentation by using a mic in the crowd, please feel free to ask those questions in the app. We'll go through those and then ask the panelists for you or the presenters for you. Also, towards the end of the day, I'm supposed to say this at the end of the day, but I'm going to say it now because I will forget. But we always like feedback. Your feedback for our conference is very important. We want to know, was the material good? Is there things we need to change about our conference? I know last year, if you attended, parking was quite an experience downtown Lexington. We had wayfinders down the street trying to find parking. So hopefully this parking was a lot better, but we're really excited to have you here today. To get started, I want to talk a little bit about the Regional Extension Center for those that have not worked with us. And at the top right of this picture is my team. And I'll go ahead and have them stand up. So all REC staff that's in the room. So this is my staff. They're great at what they do. They support me in every way possible. They've put on this great conference. I'll say when you look at that picture, it looks like we're all together, but we have staff that's located all across the state, from Paducah to Bowling Green, Bardstown, Louisville, Georgetown, Jackson, London, close to E-Town. So we're pretty much spread out across the state to make sure that, we can support those communities that they live in. So thank you all. And if you all have any questions, these are our staff. So thank you all. They really do make my job easy. Like I literally just show up. And Mindy, I'm not sure where Mindy is, but she is back there in the back. She really pulls this all together. It's simply amazing. So for those that don't know what we do, we are an organization based out of the University of Kentucky and UK Healthcare. We are we provide subject matter expertise around IT, EHR, quality improvement, electronic health records, and then different regulatory programs. So really that's our focus, is to be those trusted advisors, subject matter experts that are out working in your healthcare organizations, providing any expertise that you might need. I did mention we reside within the university, which is really valuable to us because if we don't have the expertise, we're just an arm's length away. We know a lot of people within the university that can be a resource to us to help do that, to help support you all. So it's really important. We do have our fee-for-service model. So for those services that we don't have grant funding for, we do have like our HIPAA privacy and security. We have patient-centered medical home, patient-centered specialty practice, Our value-based programs, we always know that healthcare is always changing. Value-based programs are always changing. We're focused on those. If we don't have a grant that covers those, we do have a fee-for-service model that you could be a part of. We have quality improvement support as well. And a lot of those fit into our hospital aspect also. This slide really speaks a lot because over the last 14 years, we were founded in 2010 by a CMS grant. But this really shows like all the support we've done over the past 14 years. As we looked at, 2010, the change from going from paper to electronic and doing that, let's just say the digitized age. I shouldn't even try to say that word now. But with that being said, everything has transformed over the 14 years, right? So many things have changed. And every time we look at a different program or how are we going to implement evidence-based interventions, we're touching more providers. We're helping improve better care, better outcomes across the state. And we know in Kentucky, our outcomes or our health isn't always great. So I think, by doing the work we do at the Regional Extension Center, we're here to support you and help those clinicians and providers through quality improvement. Also, a lot of our grants, a lot of our different regulatory programs, we're here to support you and to help you not receive payment penalty. And so when we look at that $120 million, we're there to actually, this was like a Medicare meaningful use promoting interoperability program. We want to be there to support you all and to find that federal money to bring it into the healthcare system in Kentucky. So you all can utilize that to promote better care. So overall, this is a really important slide to us. It's like our 14 years of being in existence, everything we've done, the lives we've touched. We couldn't do it without you partners in the room. It's like, it's a really, really big collaborative effort. So I do appreciate everyone. Now I want to say thank you to our sponsors. We have we have a gold sponsor today. They are just outside the door, but I'll go ahead and introduce them. It's the Kentucky Asthma Management Program. And if you haven't worked with this program, they've been making waves across the state around doing Excel strategies. So implementing Excel strategies to identify patients with asthma and to do quality improvement around that. They're working in pediatric practices. They're working in hospitals. And so we really appreciate all their great work they've done in Kentucky so far. Next, we have our silver sponsor, United Healthcare. And we have Whitney Allen here today with United Healthcare. And we appreciate their support. Whitney, do you want to come up and tell us a little bit about United Healthcare?
Thank you, Brent. Good morning. This is so exciting to see so many familiar faces. We were saying this is kind of like a family reunion for people that have been in this space for a long time. So Whitney Allen, I'm the Director of Clinical Quality for United Healthcare Community Plan of Kentucky. We are one of the newer MCOs, Medicaid Managed Care organizations in the market. We have started working with Kentucky Regional Extension Center about 5 years ago before we were an established health plan to do some innovative work in the market with practice transformation, providers working with their patients with diabetes. And we're now about to launch a new initiative with all 6 MCOs through the Kentucky Association of Health Plans to really bring together some innovative work to help practices really get promote all the work that they're doing with their patients. We know that you all are promoting and serving excellent care to our members, but also that financial component piece of it, that you're getting credit for all that great work that you all are doing. So we are excited for the partnership and to be here today reconnecting. So thank you all.
Thank you, Whitney. Yes, so that work is about ready to kick off. Also, I want to point out all of our bronze sponsors. These are our sponsors. They're not only our sponsors and exhibitors, these are actually also our collaborators. These are like people we work closely with on a daily, weekly, monthly basis. The good thing about it is like all of these partners and sponsors on the screen, we can make a phone call, we work together. We really make an impact and want to support your organization. So we do appreciate all of our sponsors today. We have a pretty full agenda today, I will say. I'm really excited. We have a couple guest speakers coming in to talk about security incidents response planning. And really, I think that can hit home across even like with our cell phones. What do we do when we lose our cell phone? Because, those devices are very personal to us. But actually, it's all around like what happens if you have a breach within a healthcare organization, or what happens if you don't have your data. And I know, for example, I don't know how many people in this room were impacted by Change Healthcare, but it was a pretty significant breach. I know we recently got notification about our data being exposed, but I think this tabletop exercise and them being involved will be great. Our second sessions are around SDOH and social determinants of health. And so we have Trudy Matthews and Jessica Sass joining us this morning. And then we're going to jump over to a panel, a very diverse panel, to talk about their different strategies and approaches with social determinants of health. So that's really exciting. And then I don't want to spoil our guest speaker, but we do have Harold Dennis Jr. that's going to be joining us here in just a bit. If you don't know Harold or haven't heard his story, he was in a tragic bus crash in 1988. He was the only survivor. And so we'll tell you a little bit more about him, but he's going to talk about destiny and choice, not a chance. So it's a really impactful conversation during that time. And I saw just a little bit of his slides. They were really impressive. And then we're going to finish up the day by talking about Medicaid or Medicare promoting interoperability for hospitals, and then wrapping it up with quality improvement. So make sure you stick around, because the quality improvement with all these different programs and everything we're working on is really impactful, something that we really need to focus on, since we've moved from implementation of electronic health records to now using those in a meaningful way, pulling the data out, and then looking at that data, making an impact on the care that is provided. So we do appreciate that. So with that being said, I'm going to go ahead and have Amy come up and introduce. Yep, I got it. There you go. Thank you all for joining us today. And if you have any questions, reach out. God in blue suit. So
Thanks, Brent. I do not need that, but Colin will. All right, well, good morning. I'm Amy, and I always stand beside the podium, because if I stand behind it, you can't see me. So I am a HIPAA security advisor with Kentucky REC. I've been with the REC for the past 10 years. And our premier service of our HIPAA line is our security risk assessment service. And we also do vulnerability scans. So over the past 4 years, what we've seen in security is an incredible increase in breach reports. And that's been due to ransomware and cyber attacks. And I get asked quite a bit to speak on or to share what are the most common vulnerabilities that we assess when doing these security risk assessments. And over the past 4 years, my focus has been on what can we do to, and what are we not doing that's hurting us it's making us more vulnerable for response and recovery. And I would say the top 2 vulnerabilities that I assess across the board, I see it on most of the reports that I finalize, is insufficient or a lack of security incident response planning, and pretty much an overall lack of contingency plan testing. And that's a required standard under the HIPAA Security Rule, is that not only do we have these contingency plans, which include disaster recovery and security incident plans in place, but how are we going to know if they work if we don't test them? And so those are the 2 most common vulnerabilities. Well, that leads into the next big question is, well, Amy, how am I supposed to test these? I can't take my network down to test my data back up in the middle. We're a hospital. We operate 365, 7 days a week, 365 days a year. But the answer is you can test them. You can start by trying to do some tabletops, pulling your response teams together, your incident response teams together. And so over the past year, I've been collaborating a lot with my friends at CISA, which is the Cybersecurity and Infrastructure Security Agency. We have state reps here. They are a federal agency, but we are lucky enough to have representatives in the state. So I've been working with Colin and Ryan. They will do tabletop exercises. And actually, the first time I met Colin was during a tabletop exercise. And what I'm hearing now, after so many of our clients and organizations across the state are actually participating in these tabletop exercises, is that it's all positive feedback. The people who are showing up at the table and participating in these plans and testing these plans, usually the next question out of their mouth when the tabletop wraps up is, when can we do another? Because they learn so much and they feel these meetings are so productive in preparing. So that just led me to figure out how I could get out of talking at this conference today and pass the baton on to Colin and Ryan. And I asked them, please come, don't just talk about tabletops, demonstrate to them how you do what you do. And so with that, I'd like to turn it over to Colin. And I do want to mention that in your folders, in the blue folders, I have my wonderful colleagues have printed out copies, blank templates of a cybersecurity incident response plan. That's always a big question. Where do we find templates? How do I get started? So there's a blank plan in there. If you want to use that to take notes during this tabletop, and there's also a templated cybersecurity policy that all organizations should have, especially as we're moving into this new world of cybersecurity and trying to just be more resilient, right, Colin?
Absolutely.
All right, I'm going to turn it
All
over
right.
to you. Thanks, Colin.
And much like Amy, if I stand behind the podium, nobody can see me. Such is life. So again, my name is Colin Glover. I know it's fairly early. I tend to have a soothing voice. So if you take a nap, I hope it's the best nap you've ever had. That's and that's all right. And this thing works. So I work for CISA. As Amy mentioned, it's the Cybersecurity and Infrastructure Security Agency. We're a federal agency. We're part of the U.S. Department of Homeland Security, and our role really is resilience. We don't want you to have incidents, and if you do have an incident, can you recover quickly? We're typically what we call left of boom. We're in the preparation side. If you have an incident, we're going to bring out the FBI. We're going to bring out folks like that to investigate and hopefully go after those criminals. But generally, we want to avoid all those incidents. And if we do have an incident, make it pretty unimpactful. So let's see if that works. That didn't work. All right, I lost my video. That's all right. I had a really nice video. It's very pretty. You can imagine it. It's all about CISA. One of the cool parts about CISA is we focus on critical infrastructure. And critical infrastructure, you guys are one of the most important parts of that, but it goes, commercial facilities, houses of worship, government facilities, dams, things like that. But a lot of what we do is lifeline sectors, which is communications, energy, transportation, and healthcare. Those are our primary sectors we focus on, as well as election security. We're the lead agency for that, schools, and things of that nature. But again, really a lot of it is just on that preparation side, ensuring that we can defend ourselves against cyber incidents as well as physical security incidents. You can see the nice slide up there: capacity building, risk assessment, network defense, and emergency communications. The great part of my job is I used to work for a small consultant. People would pay me, but not pay me, but pay the company lots of money to come out. As a federal agency, everything we offer is at absolutely no cost to you. No additional cost is the better phrase, because it's all taxpayer funded. Your taxes pay for everything that we do. My taxes pay for everything that we do. You've already bought these services. I'd encourage you to take advantage of them. You can see quite a few of them on there. We do a lot of threat and information sharing. A big one we want everybody in the country to sign up for is our external vulnerability scanning service. That purely scans what you have on the internet, and it's a continuous scan. Once you sign up for it, you get a weekly report that lets you know if there's any issues, misconfigurations, or vulnerabilities. For us, we have an ulterior motive. It helps us understand what the risk is across the nation. It helps us understand what we need to do better to get more threat information or take more action. But for you, again, just purely public facing, it's passive. It's not going to impact your network. We're not going to see inside your network. We're just checking out what's on the internet. There's 2 forms you have to fill out, very, very easy process. And then you get that weekly report from now until eternity. Really good program. Other ones that we have, we do a lot of assessments, but Amy's crew does a lot of that with you as well. A lot of it's just consultation. If you don't have an incident response plan, you have that template in your folder. That's a good place to get started, but we'll actually work with you on writing that incident response plan. I won't write it for you, but we'll talk about best practices and ways that you can approach it within your environment, actually tailoring that incident response plan so it makes sense for you. And then obviously we do tabletops. I do tabletops locally, I facilitate them. We also have the National Cyber Exercise Team. Amy may have mentioned it. We will have the National Cyber Exercise Team come out here in March, and they're going to put on a big tabletop with Amy. And that's going to be a really, really good experience for everybody. They do a great job. They write the whole thing. They facilitate it. Soup to nuts. If you're a big organization or you want a more complex exercise, that team does an excellent job, but it takes about 6 months to get on their calendar. With me, a month to 2 months, and we can get one done for you. I've got the vulnerability scanning. That's the report card you get if you sign up for it. If you're not into cyber, you don't want all the details, this report card does a really good job. It tells you how many things you have on the internet and if any of them are vulnerable, pretty easy. We also have a number of tools that are available to you. All of our tools are on GitHub or other places, completely free. A big one is as we move to 365 or Google Workspace for things like email, applications, things like that, those systems are not secure by default. I promise you. When you sign up for it, you need to go in there and turn certain things on and turn certain things off. A lot of people may not realize that. So these tools, they're locally ran. You download the tool off GitHub, you locally run it, and then you get a report that tells you which is insecure and things that you need to go turn on and or turn off. Super easy to run. If you have a small tenant, I've used Scuba Gear before, small tenant takes about 15 minutes to run and it gives you that nice report. I would encourage you to take advantage of it. Again, it's available off of our GitHub site. This one, we want everybody in the world to sign up for. Amy talked about vulnerabilities, and vulnerabilities has a vague description. Our known exploited vulnerabilities, these are software issues that we see threat actors taking advantage of. When a major vulnerability comes out, threat actors can scan the internet in 12 minutes looking for that vulnerability. So we've compiled all of this. There's about 1,100 or 1,200 right now. It's divided up by vendor, but we'd encourage you to sign up for it, or at least tell your IT provider or IT person to sign up for this list. You can go to our website, just Google the known exploited vulnerabilities catalog or CISA KEV. You scroll down the bottom of it and you can sign up for it. Super easy. These are the vulnerabilities that we know threat actors are exploiting today. So patching these is absolutely critical. There's lots of, if you sign up for various things, if you're into IT, there's thousands that come out every day. Which ones do you have to pay attention to? This list actually tells you the ones that we know need to be patched immediately. So talking about threats, everybody knows about the threats at this point, I hope. At least I hope you do. Cyber threats. Who's the target? This is something I run into every day. A lot of facilities believe that they're too small. Threat actors don't care about me. We don't have any money. We don't have any information. You guys know that's obviously not true. You guys have lots of information, but you still might go, I'm in Jackson, Kentucky. Somebody in Uzbekistan doesn't care about us in Jackson, Kentucky. 90% of the cyber crime and cyber activity that we see is automated. They're just randomly scanning the internet. They're testing things automatically. They're sending out massive emails. They don't care. If somebody has a vulnerability, if somebody clicks on an email, you're going to get attacked. It doesn't matter where you are, how much money you have, how little information you have. You're absolutely at risk. One of the biggest aspects of ransomware and biggest aspects of ransomware in healthcare is we can't afford for healthcare to go down. Hospitals have to stay up. Healthcare providers have to stay up. What that means is if you get hit with ransomware, there's a good chance they're going to get paid. So they're going to target healthcare because, again, we can't afford for it to go down. So they have a higher chance of getting paid. So they know to target healthcare. So if somebody clicks on that link, if you have a vulnerability on your firewall, there's a solid chance you're going to get hit and they're going to try to get paid. You're absolutely the target. Do not think that you're not the target. Don't ever think that. It's all the time, 24/7, 365. They're scanning, trying to find new victims, and healthcare is one of those primary things. And it's not me just saying this. This comes from the FBI. They publish a report every year. This is the 2023 one from ic3.gov. And this is critical infrastructure sectors impacted by ransomware. The defense industrial base reported one last year. Healthcare and public health reported 210 last year. And these are just reported to the FBI. This number is well underreported, I promise. This came out yesterday. Last year, nearly 400 US healthcare institutions hit with ransomware over the last year. This is according to Microsoft. Again, it's not me making this stuff up. It's not me just saying, hey, you guys need to be scared. These are what the numbers say. They're going after healthcare. It's in the news every day, obviously. We've obviously had impacts here in Kentucky, but a lot of this stuff isn't reported. People just kind of brush it aside, don't report it. That's going to change next year. But still, constantly, we see healthcare providers across the nation being hit by ransomware. This is a survey from Sophos from last year, I think. Yeah, 2023. So one of the interesting things I found, this is again the survey that they did. Healthcare reported that they got the data back 100% of the time. 73% of it was from backup. That means more than a quarter of the time they paid. I'm not very good at math, but it comes out at 27%. 27% of the time, a healthcare organization paid that ransom. That's how they got that data back. The median ransom payment was $2.5 million. An average recovery cost was $2.2 million. It's not just the ransom that's expensive. When the city of Atlanta got hit, their ransom was only $70,000, which for them was pocket change. They've since spent $42 million in recovery costs. It gets real expensive real quick after that. 47% reported they were able to recover within a week, which means that more than half took more than a week to recover from the incident. Even if you've done everything perfect, you've got good backups, you have your data, life is good, expect to be down for more than a week. That's just the way it goes. You got to do forensics. You got to wipe devices. You got to pull that backup down, all of that. It's not quick. Even if you've done everything right, you're not coming back up tomorrow. It's going to take time for you to get back up. Just more stuff. And again, it's in the news all the time. Hospitals notify patients after ransomware attack. Hospital targeted by sophisticated social engineering attack. Hospital faces service disruption after cyber attack. On and on and on and on. One thing I try to dispel, especially for some of my smaller organizations that may not have dedicated cybersecurity, is cyber attacks are not magic. It is not some wizard sitting in a basement doing matrix style attacks. Most of this stuff is automated. Most of it follows a certain pattern. Since it follows a pattern, we can detect it if we have the appropriate defenses in place. That initial phishing email, that initial vulnerability exploitation, that's just to get a foothold on a box. If I can attack one system, I just can attack that system. I have to move through a network in order to get my malware deployed, get my ransomware deployed. That takes time. We have seen dwell times come down because they've gotten better, but they may be in a network for several months before they actually launch the ransomware attack. That gives us time to detect it if we have the defenses in place. One of the biggest defenses and one of the biggest vulnerabilities we see is what we call a flat network. And a flat network means that all the computers can talk to each other. That is not a great place to be. If all the computers can talk to each other, that makes my attack, my movement through the network much easier. Instead, what we would like to see is called segmentation, where only certain systems can talk to certain systems for certain reasons. It's an architectural thing that you do for computers, but it can really reduce your risk. Yeah, they get on that, somebody clicks on that phishing email, they get malware on that one computer, that one laptop. That's bad, but we just lose that one laptop. Probably not the end of the world. If it's a flat network, it's so much easier to pivot through that network, get my malware deployed, and now we can encrypt that whole network, which is a really, really bad day. So doing things like segmentation, and your IT provider, your IT person should know what that means. If they don't, I'm happy to talk to them, and we can talk through what that means to them and how we can do it in your environment without spending a whole lot of money. All right, so incident response plan. How many folks have an incident response plan? Well, all of you do. You all have the template. Amy gave it to you today. So each and every one of us have an incident response plan. So the template she provided, let's see if I have it here. This actually comes from us. This is a CISA provided template. It's pretty simple, pretty basic, but it's a good place to get started. One of the key features on here, and I think I've got stuff. So one of the key features on here is your contact list. If you do nothing else, write down who you need to contact in the event of an incident. Who are the primary people that need to be notified within your organization? Who are the primary people that need to be notified outside your organization? I think my contact information is at the end of this slide deck. Please write my name on here. I can't promise you we're going to provide all the support in the world, but we're going to try. That being said, if you have a ransomware incident, because it's in the news all the time, if you have a ransomware incident, there's not much we can do. Good ransomware is very, very difficult to defeat. I'm going to come out. I'm going to tell you, I'm sorry. I'm going to hold your hand and rub your back and tell you it's going to be okay. But unfortunately, there's just not much we can do. I try to limit expectations here. But this came from a study recently. It was put out at the RSA conference. Organizations lacking an incident response plan took an average of 9 days longer to respond, and it cost them an average of $600,000 more per incident. Having an incident response plan really, really saves you money at the end of the day. What's that return on investment? The numbers have been found. It's absolutely critical. So again, take this incident response plan. You can scribble on it. Nobody cares. Start with that contact list. Who do I call in an incident? Who needs to be notified? That really, really is critical. If you take this or you download or whatever, and you type it out and you save it on your computer and you get hit by ransomware, it's not going to do you much good. Having a physical paper copy of your incident response plan is absolutely important, absolutely critical. When you start doing incident response, when you start looking at it, this is cyber incident response, there's emergency response and other things. One of the biggest parts of it is preparation. You download any incident response plan template, there's a bunch out there. If you follow the US government guidance from NIST, preparation is absolutely key. That's where you should spend the bulk of your time on doing incident response. That preparation is having a cybersecurity program, whether it's following the HIPAA Security Rule. I know HHS is getting ready to introduce some new cybersecurity requirements. We have cybersecurity ideals. They're out there, but actually having a cybersecurity program is the first step in doing incident response. Because if you don't have a security program, you're going to be doing incident response all the time. But it's training, it's doing those tabletops, it's ensuring staff does cybersecurity awareness training. All of those things go in your preparation stage. Detection, how can you detect malware before it does something bad? How can you detect somebody banging up against your firewall or VPN? All of those things. Containment, isolating. If somebody has a computer that starts encrypting, are you just going to start unplugging network cables and turning off Wi-Fi? And that's fine if you do, but that's part of your containment strategy and identifying how malware is spread. Eradication, eventually getting rid of that malware and evicting the threat actors, and then how do you do recovery? One of the big ones for backups is, can you confirm that your backups are good? Who's responsible for that? If all you have is on-premise backups that are, if you have a server and you've got an external hard drive connected to it, and that's your backup, the threat actors are going to encrypt that, or they'll delete it. Recently, just yesterday, we had a ransomware incident here in Lexington. They had an external hard drive connected to their system, and then they had that external hard drive that was backing up to the cloud. Unfortunately, the credentials for that cloud backup were stored on their network. The threat actors collected that information, they logged in to the cloud provider's backup and deleted that backup. ensuring that your credentials are not stored accessible to attackers is absolutely critical. Or going with a backup that's immutable, that can't be deleted, is absolutely key. If all you have is an external hard drive plugged into a server that's always there, threat actors will get that. But also if you have a natural disaster, and the tornado in Graves, the courthouse got hit, all they had was on-premise backups. Everything got sucked to the winds, or it got sucked up and thrown in the winds, gone. They had to rebuild from scratch. And it took months, and they're probably still rebuilding at this point. Looking at that, ensuring you have those things in place. And finally, doing your lessons learned, whether it's through a tabletop exercise, hopefully not an incident, but learn from whatever it is. Plan templates, again, y'all have a plan template. That's a good place to get started. There are other ones out there. The Texas one, the Incident Response Team Red Book, they do a really good job. I like theirs. The NIST one is kind of the gold standard. And then recently we put out the Federal Government Cybersecurity Incident and Vulnerability Response Playbook. There are hundreds of them out there. Just pick one. And even if you don't like it, it's a good place to get started. And then you can kind of grow your program from there. Okay, so tabletops. Why do we have to do tabletops? I just recently was reminded of a quote. Mike Tyson said, everybody's got a plan until they get punched in the mouth. Hopefully you don't get punched in the mouth, and a tabletop provides the opportunity to exercise your plans before you actually have to use them. If you have a plan and you wrote it and somebody wrote it 10 years ago and nobody's ever looked at it again, it doesn't do you much good. There's a reason we did fire drills as kids to reduce that chaos, reduce that stress. There was a hospital here that got hit by ransomware. They had to revert to faxes, traditional faxes, manual, old analog faxes. Much of the younger staff had never actually used an analog fax. So they had to spend some time going through an incident of figuring out how to use that analog fax. Not a big deal, but it was a stressor. So going through this, practicing, identifying some of those issues that might creep up during an incident. So the purposes of it, identify the areas that need work, validate the areas that do work, prepare your people, increase your resilience, establish flexibility, and educate up and down. That education up and down is absolutely critical. A lot of our tabletops don't focus on technical response. We have tabletops that do, or we can change it so that it does, but a lot of it is on organizational decision-making. Again, the IT staff is going to do the IT things, or the cybersecurity staff will, but how do we as an organization respond to this type of incident? What steps do we need to take? How do we talk to our patients? How do we talk to the media? How do we talk to our staff? So keys to developing, don't reinvent the wheel. And I've got another slide on it. There's many scenarios out there. A lot of people do this every day. It's not something you have to come up with on your own. Identify the goal and the level of the TTX, whether it's decision makers, internal staff, and responders. We would love to see you include your important external stakeholders. If you use a managed service provider, an IT vendor, bring them in. If you have cyber insurance, bring them in. If you're doing a physical security tabletop, bring in law enforcement, bring in the FBI, things like that can all make that better. We had a ransomware incident with the school recently, and that school had cybersecurity insurance. The guy that managed the insurance was the chief financial officer. So the IT guy said, I know we have cyber insurance, but it's managed by our finance guy. The finance guy was on vacation the day they got hit. They couldn't get hold of him. They finally got hold of him. Then it turned out the insurance broker was on vacation. So it took 3 to 4 days to finally get hold of their cyber insurance so they could get support from their forensics. That's bad. It would, that insurance provider actually had a 1-800 number. They could just call and hit the red button, send up the bat signal, and have somebody come out and support. They didn't know that because they had never gone through the process. They had never walked through any of this. So inviting your insurance broker, and insurance loves to see people do tabletops, so it may help out on your premiums, but still walking through that process, getting the folks that need to be engaged. And once you start going through it, if you actually do your own tabletops, the questions will tend to drive the focus of the tabletop. So if you want to do it on your own, and highly encourage everybody to do tabletops all the time, at least annually. We have a whole bunch of scenarios already canned and available. At absolutely no cost, you can go to our website and download these scenarios. We have 20 cybersecurity one or so, about 80 physical security, and then we have 2 convergent ones. There's also a bunch of documentation. We have a facilitator's handbook. If you go, I don't know how to do a tabletop, but I need to do it, you can download the facilitator's handbook and it walks you through the steps of doing it from soup to nuts. Super easy. We've got the PowerPoint slides that are available. You can download the slides, throw the scenario on there and get started. Planner feedback, an after action report, and then a fact sheet. But all of that's there, all of it's available to you. All right, so now we start the interactive piece. And if you guys sit there quietly, this is going to be a long time because I'm going to stand up here. It'll be good. All right. So all of you are healthcare providers. How important are computers and digital systems to your daily life? Yes, sir. It's absolutely essential. If those go down, if you lose them, can you remain operational? Yes or no? And is that sustainable? So again, so if you lost all your computers and you had to switch to completely manual operations, how long could you operate? Ma'am? How long? A week. Days, maybe a week. Okay. We are absolutely dependent on that. Now, I follow up that question is which services are absolutely critical to your operations? And has that been defined anywhere? Probably not. Most places I go, it's not. So going through that process of actually looking at and defining which services are the ones that are critical to us and what are the systems that support that is a huge process in your incident response and really in your contingency planning. What systems are critical? Some are important, some might not be. I ask the question all the time. And people tell me that payroll is critical. Your organization does not exist to pay people. Your organization exists to provide healthcare. I work with schools a lot. The schools don't exist to pay their teachers. My wife's a teacher. I hope that they pay her, but that's not the reason they employ her. They employ her to teach children. They employ bus drivers to get children to school. What are your critical services? And that's an absolutely key aspect of it. All right. So this is what a tabletop looks like. And we're going to kind of go through it. I'm going to go through it quickly. I want to leave time for questions and answers. We put out a lot of alerts. We put out alerts all the time. I email them out. So CISA, FBI, HHS released a joint alert regarding a rise in cyber attacks targeting healthcare organizations. The alert describes the TTPs used by cyber criminals, including phishing emails, ransomware, remote hacking, DDoS attacks, and data exfiltration from healthcare organizations. What if I send this out, right? Amy, I sent it to Amy. She blasted it out to everybody in this room, everybody online. What, if any, actions would you take in response to this? Would it make sense to you? Who would you send this to? And if you don't know anybody, it's time to start thinking about that. That might be something to jot down. Who would I send this to? Day 9. Your employees receive email notifications from your managed service provider requesting they update. So your managed service provider, your IT vendor, requesting they update their profiles prior to the launch of a new HR system. The email contains a link and attachment named update_form.docx. Employees working at remote workstations across facilities click the link and are asked to log into their web portal. Upon logging in, they're brought up to a 404 error page. Some employees also open the attachment and click to allow macros to run. Anybody heard of macros? What's a macro, sir? Right, you, sir. Yeah.
I've heard of them. I don't know enough about it.
Yeah, we can bring the microphone out. So a macro. So in Office documents, Excel, Word, things like that, you oftentimes will see a little banner on there that says enable content. Right. A couple of years ago, Microsoft said, we're going to block content by default. And so when you download something from the internet, you may see that little banner up there that says enable content. What that does is that allows macros to run, and macros are a cool feature that allow you to automate certain tasks. So if you work in finance department, they tend to use macros because it automates some of their Excel spreadsheet stuff, which is really cool. So macros actually have a programming language behind them. You can write programs in Office and Word, Excel, or whatever to complete those tasks. Threat actors, cyber criminals, will actually write malware that takes advantage of macros. So you download that Word document, enable content, you're allowing macros to run in the background, which could contain malware. So we actually encourage macros to be turned off, except for the users that actually need it. But something to be aware of. So, all right. So we talked about that a second ago. Have you conducted a formal risk assessment? And obviously, the HIPAA security risk assessment, awesome. And you all got to do it, and please do it. But a formal risk assessment really looks at how a threat actor could impact your organization. It goes through details. What routes could a threat actor use? All right. Who has a cybersecurity training program? How many of y'all have a formal cybersecurity training program for your staff? One, sir. How do y'all do it?
We have annual in-services that all employees must take, and then there's a test at the end.
Awesome. Very good. Anybody doing phishing testing? How do you do phishing testing, man? Okay. Have the results changed since you've begun that?
We don't have an actual training program. We're just sending out reminders about here's how cybersecurity is, you know, talking about different, those sort of things to all parts of.
Awesome. Good.
Can you-
And have the amount of people, so do you have a phishing program? Has the amount of people clicking gone down? Awesome.
Can you
And
explain?
that's my goal.
Can you explain what phishing is?
Yes,
For
sir.
those in the audience?
Yeah, and so phishing is those malicious emails. You get a lot of them around Christmas. You'll get something from FedEx saying your package is on its way, and you're like, I didn't order a package, but I got to check this out anyways because I need my package. So that's one method of phishing. There are also, it could be as the scenario. Let's see if I can go back. As the scenario suggests, is threat actors will send out phishing email. They'll send out emails that appear to originate from somebody you know and trust. It will look like it comes from, your vendor or somebody like that. And that attachment or that link, the attachment may be malicious. That link, one of the biggest routes they go is just stealing credentials. So many of us have switched to the cloud using things like Office 365. A lot of the software we use now is cloud-based, things like that. You click on that link, you enter in your username and password, and that actually is going to a threat actor's controlled infrastructure. They now have your username and password. That's a typical phishing. Some of them I've seen, and I've actually been, and spear phishing is more directed. I actually have gotten emails where they'd gotten into the email accounts of somebody I know and trust, responded to an email I had sent with a malicious attachment or link. Those are really, really hard to spot. So I love the idea of we're too scared to click on anything anymore and life is good. So.
Right. And for those that couldn't hear, can you hear me? Okay. For those that couldn't hear, Becky was talking about they use a vendor that actually does phishing attacks. So it sends out emails to all their email recipients within their hospital. And then they track who clicked those so they can then base education around those clicks. So that's for those that didn't hear.
Absolutely. And it's a good point. So there are vendors out there and there are routes you can do to set up yourself where you can first you train your employees not to click on, suspicious links or attachments. And then you send them out test emails that contain benign links or attachments. And then you can measure what that click rate is. And for those users that click or tend to click, we have some folks that are what we call natural born clickers or serial clickers. Train them all you want, but still, once they click on that, they get put into more training and hopefully get them to stop. Now, if you do have somebody in your organization that no matter how much training you offer, they're going to click, which is me, I click on everything just for funsies. Then you have to do some additional security architecture to ensure they're not at risk. How many folks are using multi-factor authentication? Am I going with about half here?
It looks like it.
About half?
How many know what multi-factor?
Yeah, how many know what
authentication
multi-factor
is?
authentication is? About half. Okay.
Okay.
So multi-factor authentication, and think about hopefully with your bank, there's an app on your phone or they send a text to your phone. So you type in your password and you get that text to your phone. That's multi-factor authentication. There are no silver bullets in cybersecurity. There absolutely is not. But multi-factor authentication, implementing it everywhere you can, is one of the most important things to reduce your risk. People lose passwords every day. They get tricked. It's an easy password. There's a misconfiguration, whatever it may be. Multi-factor authentication is one of the most critical things you can do. Ideally, and nobody's there yet outside of the government and some major businesses, is multi-factor to the desktop. Most people have multi-factor to cloud environments, but we want to see multi-factor all the way to desktop. You absolutely need it for remote access. If you have remote access, it could be via VPN, it could be via something like Go to My PC, Chrome Remote Desktop, whatever it may be. You absolutely need to turn on MFA for that. That is a huge vector for threat actors to come in. Skip ahead a bit. Hopefully you have backups. All right. So updates are pushed for patient monitors. A third-party EMR vendor shows up unannounced to install some stuff. We're going to skip ahead of the good stuff. All right. On day 20, a system administrator discovers active accounts for IT employees that left the organization over the past 12 months. Admin cuts them off. Day 23, nurses on the floor report that patient records are displaying incorrect information about medication, diagnosis, and personal information. Day 23, the afternoon, staff discover bedside monitor data is inaccurate and the infusion pumps are not operating properly and are failing to deliver infusions at the correct rate. So this is make-believe, but this is based on what we've actually seen in hospitals before. Let's see here. Day 25, ransomware messages appear on computers throughout the organization and users report they are unable to access their files. A message is displayed that reads, "Hello, your files have been liberated. We have your data. But do not fear because for the sum of $1 million, your files will be returned. The decryption key will expire in 72 hours. Please submit payments to the wallet below or we will start selling patient data to the highest bidder." So not only are they encrypting all your data and locking it away so you can't access it, can't use it, they are also exfiltrated all of the data that you own and are going to sell it on the dark web. It's called double extortion, and this is the way threat actors operate. We've had many companies that probably had good backups, but they were scared of the data being leaked, and so they went ahead and paid the ransom. Day 26, current and former patients contact the hospital saying they received calls from someone claiming to have access to the medical records and offering to return them for a fee. The patients are provided enough information to verify the callers have their records. Patients say the fees range, and they're also threatening legal action, patients are. Day 27, patients request transfers to other local hospitals because they feel unsafe. They also demand the return of all their medical records, as well as the removal of their records from your network. The patients state they will never return to your facilities. What are your priorities at this point? You guys are all looking kind of sad. It's all right. What are your priorities? Are you worried about the network? Are you worried about patient care? Are you worried about, the media and your patients harassing you? All the above. And also they've leaked your employee data too, I promise. And they're probably calling your employees, threatening them unless they pay the ransom. That's still going on as well. Do you have ransomware policies and procedures? Does anybody have ransomware policies and procedures in their incident response plan? How would you work with your cyber insurance providers or other third party? Do you have cyber insurance? And if you do, you do. All right. Do you have relationships with a third party vendor that could assist you in this incident? Again, literally, just what is today? Thursday. It was Tuesday night. I got a call from a local company. They were in the process of interviewing 4 incident response companies. They're having to take time from dealing with their ransomware incident to interview, do a quote and contract and all that to figure out which one to help them. That's a pain. That's not the right time to be doing it. Having that already planned out, at least understanding who you want to work with. Who's going to pay the ransom? Who's going to make that decision in the organization? What does that look like? Who has the authority to do it? Do you have a board of directors? Do they have to be involved? Do you have outside counsel that's going to advise you on how to do all this? Do you have inside counsel? Who has that expertise in your organization? And how do you contact them? And if their phone numbers are stored on your computers and that just got hit by ransom, what's that next step? Legal and reputational ramifications, all this stuff. What security breach notification laws, when do you have to notify HHS? How soon do you have to notify them of this? Do you have to notify Kentucky? If you, I think it's 500 record, I'm not a lawyer, but at a certain point, if you lose that data, you have to notify the state under Kentucky regulations. And who's dealing with the media? Do you have somebody that's gone through media training? If you want, FEMA actually has media training for free. But do you want me? I'm just a schmuck. Do you want me talking to the media? Do you want me posting on Facebook about this incident? Do you have policies that say they shouldn't be posting on Facebook, Instagram, or whatever social media you want about these types of incidents? You probably don't. And so the last question I ask on everyone is, based on the discussion, what changes would you implement to increase the resilience of your organization? And a lot of it's going to start with that plan. A lot of it's going to start with an incident response plan, because we got to work on the preparation side. We have to have all this stuff built out, because everybody's going to make it through a ransomware incident. Most people make it through a ransomware incident. But that time, that first 72 hours, that first couple of months just absolutely sucks. I know a lot of companies that basically have PTSD after dealing with the ransomware incident. They are scared. I prefer for you not to have to deal with that. Ransomware is just a miserable, miserable time, because it will shut down operations. A couple of years ago, I was working with a behavioral health organization. The CEO of the organization was literally in tears because they had lost all their patient data. They didn't know how they were continuing to operate. They didn't know how they were going to continue to support their patients. That is the risk that we're facing. There are lawsuits right now where former patients have sued hospital providers because of, in their opinion, misdiagnosis and mistreatment due to the fact they were hit by ransomware. It can cost lives. It's just terrible. So we want you to be prepared. We want you to have the plans in place. One, just don't get hit by it. But two, if you do, how can we respond? How can we recover quickly? And going through tabletops to flesh out your incident response plan or to test your incident response plan is absolutely critical. So more resources. If you like, if that was boring to you, the concept of sitting there for 2 hours and me harassing you with questions, which can be kind of boring, there are actually incident response games. One is called Backdoors and Breaches. It's made by a company called Black Hills InfoSec. It's free online. and it's Dungeons and Dragons for incident response. It's a lot of fun. Takes about 20 to 30 minutes to get through a game. I play it quite a bit with a lot of stakeholders, and really puts you in a competitive spirit to do it. And then obviously, the template you got is from our incident management guide, which is a really, really good resource. We also have an incident management review assessment, where once you have that incident plan in place, we can actually do an assessment against it. Here is my contact information, and I am happy to take any questions you may have. And that was perfect timing. I'm good at what I do. Yes, ma'am.
Hold on, one.
We'll do the microphone.
I'm gonna bring you the mic. We'll mic you up, Marilyn.
I just wanted to share, as privacy officer, and we have a very engaged and active information security officer and team also. We started carrying our cyber coverage about 3 or 4 years before all of this really started hitting. But you were talking about insurance and coverage and who knows what about it. One of the things that we learned rather quickly, and I'm the one that actually manages our insurance coverage. When it comes to cyber or data response, incident response coverage, you really need to spend some time and figure it out. Some of the improvements we've been able to make came as a direct result of working with a national insurance brokerage firm for our cyber coverage as well as other coverages. And they gave us, from the insurance industry, because they had suffered so much loss, like 12 priority items. And a lot of them are directly linked to what you're talking about. And for us to get more efficient costs for the coverage, we had to take steps and make steps to plan for upgrading, like multi-factor access and those types of
For
things.
sure.
So it's not like the old days where you could just go to perhaps a smaller or a local agency to buy the coverage. It's become so sophisticated because of all of this activity. So I would just encourage everybody to have somebody to take the time to dig into. And also the limits have changed. Some of the carriers are pulling out. And if you have cross coverage with some of your other policies like property coverage, they are dropping limits or not even covering, breaches or security incidents like they used to do for loss of business income. So I would just say that we have learned through a kind of a progression. Fortunately, we've not had to use any of it.
Good.
But it is something you really need to sort of be well informed and study and make the right people aware of that stuff, because it's more challenging than it used to be.
Absolutely. So would you be willing to help out your colleagues if they had questions? If anybody in the room had questions about cyber insurance, because I'm not an insurance expert, would you be willing to help them?
Sure, if I know.
All right, fair enough. So there we go. Thank you so much. I appreciate that.
Thank you. We do have one question online, and it says, we are a critical access hospital and realize we are as vulnerable as large hospitals. Do you have any statistics on actual ransomware attacks on small hospitals?
I don't have the statistics available. We can dig them out. But no, I don't.
Okay.
So
And it sounds like it doesn't matter if you're small or large.
it doesn't. I mean,
It's-
the ransom payment may be different.
Right.
So when we talk about medium ransom payments, we have some of our large organizations that are paying tens of millions of dollars. But that's the average. If you actually look at and I forget my statistics numbers, but the vast majority of ransom payments are going to be in the tens of thousands. Because they know, a small organization can't afford millions of dollars. So generally you're going to look in that $40,000 to $70,000 range, which most organizations, regardless of size, can afford. So that's probably the biggest difference. But yeah, the risk doesn't really matter. Great question, though.
Okay.
Yes, sir.
1 second.
We're going to use a
bring this-
microphone.
You're gonna get mic'd up. Sure. Thank you.
I had a question, for the facilities or agencies that pay the ransom,
Mhm.
what percentage of those that pay the ransom actually get the data back?
And that's always a tough one. So according to the survey, according to the SOFO survey, they did. So one of the things, and there's a lot of fracture and a lot of moving pieces of ransomware actors. There's a lot of folks, so like Change, and this was all in the news. I can't say whether it's accurate or not, was in the news. So Change got hit by what's called a ransomware as a service group. So the major ransomware actors just support folks that don't know what they're doing. and the major ransomware actors get a cut of the payment. So according to the news, again, I can't confirm that it's accurate or not, Change was hit by one of the franchise groups. Franchise, then Change paid the money. The major ransomware group said they broke up and didn't pay the franchisee the ransom. And the franchisee actually was the one with the decryption key. So like, until we get paid, we're not giving it to you. That being said, ransomware actors treat this as a business. If their product isn't very good, they're not going to get paid. So if it gets out that they're not able to decrypt after the fact, that's going to get out and people are going to stop paying them. So it's in their best interest to provide that customer service to ensure you get your data back. At the end of the day, that this is what these guys do for a living. There is no honor amongst thieves, but and obviously no guarantees, but generally most people get their data back.
Any other questions from the other side? Okay, we have Becky.
Okay, so the third-party vendor that we've worked with suggests that you never pay the ransom because with the companies that they have helped through these cyber events, they've indicated that, you know, even though you may get the data back, that bad actor still has a copy of it and can still sell it,
Mhm.
contact people individually, all those sort of things. So
And again, we don't condone paying the ransom. The US government does not condone paying the ransom. It is not illegal. Ultimately, it's a business decision. Is what it
So-
boils down to.
I was just gonna say, so I hadn't really thought about the fact that hackers or the ransomware agents would be calling people individually or making those demands also individually. So my husband and I have been getting notices from the Change Exchange, and it seems like for us, there's a level of insensitivity to these large data leaks that occur
Mhm.
more regularly. But for us as a regional and medium-sized healthcare system, the reputational harm is so instant. And I'm
Mhm.
just thinking in my head, would you suggest, or can we do more to inform the community with public service and or newspaper articles or whatever, just to keep them aware of while we do all these things to protect and to secure their information, but to help make them aware too of it's getting harder and harder to do this. And when it happens, how we are prepared to the extent that we can make it available.
Absolutely.
Because
I
you
mean,
just get so certain that all of it's out there anyway. It's probably, we're all getting our data sold every single day at this
Mhm.
stage of the game, but
and you know, so it was one of the two school districts, LA or Minneapolis got hit last year or 2 years ago, maybe 3 years now. And so all the student data got leaked, but part of it that got leaked was guidance counselor notes. And these were potentially sensitive conversations the student was having with their guidance counselor. The threat actors were contacting parents saying, if the money's not paid, we're going to release these guidance counselor conversations on the open internet for the purpose of getting the parents to contact the school board to pay the ransom. But yeah, getting out in front of it, especially during an incident, being as transparent as you can is absolutely critical, whether through the media, you know, social media, whatever route to go. But yeah, also having those conversations with patients about how you protect the information could be very, very helpful. Great point. And thank you.
All right. Well,
Yeah.
thank you, Colin, for participating with us today. I appreciate all the knowledge and insight. Colin will be with us for a little bit longer. I'm not sure if you're here for the rest of the day, but reach out if you have any questions. So next up. So
All right.
thank you.
Thank you.
All right, so throughout the day, we have a couple of awards that we're going to be giving out. And so I want to take the time right now to do our first award. And of course, it's around privacy and security since we've been talking about that. And I'm excited to have Jennifer Neesmith come up to the stage. Come on up, Jennifer. Okay, entire staff, come on up. Yes. So today, we're giving the award to the Kentucky Health Center Network. They support 27 organizations comprising over 600 clinic sites, playing a pivotal role in advancing healthcare security across Kentucky. Under the leadership of Jennifer Neesmith, KHCN has set the gold standard for HIPAA compliance and data and security in community health centers. The continued funding provides technical assistance and support to help safeguard electronic protected health information and keep supported organizations up to date and compliant with HIPAA regulations. This unwavering commitment to HIPAA security not only strengthens patient trust, but also elevates the entire healthcare system in Kentucky. Jennifer Neesmith's leadership has been instrumental in the powerful partnership between the Kentucky Health Center Network and the Regional Extension Center. Together, we have driven significant advancements in health IT adoption, security, and interoperability, ensuring that health centers can focus on delivering exceptional patient-centered care. Thanks to Jennifer's vision and KHCN's support, community health centers are now better positioned to protect sensitive health information while streamlining care in Kentucky for the most vulnerable populations. Her efforts are undeniably help create a safer, more efficient healthcare system, making her the recipient of the HIPAA Excellence Award from the Regional Extension Center. Thank you. And I don't know, where's the award at? Yeah, leg lamp, yes. You get warm. Yeah, it's a major, yes. I'm not sure where it's at, but we'll get it here in a second. So, and then we'll have a place right outside to take some pictures as well. So, but thank you all for all your support. They really do support all the community health centers across the state. They provide funding to help do security risk analysis and to make sure that they stay abreast on all the changing regulations and really identify and help mitigate any of those risks. So we do appreciate KHN's support in privacy and security across the state. Thank you. All right, so we're gonna take a quick break and we will reconvene at 10 a.m. At that time, we're gonna have Trudy Matthews and Jessica Sass come up and talk. So thank you. All right, here's the award. Thank you. Perfect. All right. Do you want to say anything, Jennifer? Do you want to come up and speak? Yeah, come up and speak. Yeah, I know you were kind of shocked.
Just really quick, I just want to share that. So we're a health center controlled network. There are 49 across the country. Not all are state-based like we are, but I will let you know, just in working with all the folks across the country, not everybody has a regional extension center. I think maybe there's just one more in the nation, if that. So we are extremely lucky in Kentucky to have a regional extension center and to be able to provide all the services that they provide, because for one thing, it's a lot more affordable than some other networks when they try to support their members in the ways that we do. They're not able to give the in-depth service that we are just because of the regional extension center. So we really appreciate everybody using their service, because if they didn't, you wouldn't be here, right? So, and we're very lucky to have you. So thank you.
Well, thank you. So we'll go ahead and break and we'll rejoin at 10.